Hello friends, greetings for the day. Myself Dr. Dev Jha, Pediatric Pulmonologist and Intensivist, India. Today I am going to describe in short the basics of mechanical ventilation. So what is the difference between spontaneous ventilation and mechanical ventilation? The only difference is spontaneous ventilation is a negative pressure ventilation where air is sucked in from the environment into the alveoli, and mechanical ventilation is a positive pressure ventilation when we push air into the lungs. So there are two main terms, oxygenation and ventilation. Simply oxygenation is movement of oxygen into the capillaries, and ventilation is removal of carbon dioxide from the alveoli and it will come into the environment. So there are two types of respiratory failure: hypoxic and hypercapnic, type 1, type 2. There are various reasons of respiratory failure, and we have to ventilate three types of lung: normal lung, stiff lung, and hyperinflated lung. Normal lung, there is no pathology in the lung but pathology in the central nervous system, and we have to ventilate the lung. And stiff lung, when there is pneumonia, when there is pulmonary edema, when there is ARDS, lung becomes stiff. And over compliant lung, that is hyperinflated lung in cases of asthma or COPD. So there are concepts of trigger, limit and cycle, and I have made a mnemonic TLC. Just remember TLC, like total leukocyte count. TLC, trigger, limit and this cycle. So breaths will depend on these three: who is triggering, who is limiting, and who is cycling. So there are different types of breath. If all trigger, limit, cycle, all three are done by the machine is triggering the breath, machine is limiting the breath, and machine is cycling the breath, it is mandatory breath. But if patient is triggering the breath but it is limited and cycled by the machine, it is assist breath. And if the patient is triggering and the patient is limiting and only cycling is done by the machine, then it is called support breath. And if everything that is triggered by the patient, limited by the patient and cycled by the patient, it is called a spontaneous breath. So this is the basic concept. And limit is what? Pressure limit usually, or volume limit. So this is the usual concept of breath. With this concept we have to operate ventilator for the treatment of children on ventilator. So ventilator is not the cure of the disease, it is just a support system. And while we are maintaining the oxygenations, that is PaO2, and ventilation, that is PCO2, while we are maintaining these two parameters basically, and pH, we are treating simultaneously, we are treating the disease conditions. And the role of mechanical ventilation will be over when the disease will be cured. So this ventilation is just a support system till we manage the disease of the children. So for more knowledge of mechanical ventilation, what is this, how to operate this accurately, please join fellowship program in Pediatric Pulmonology with Bronchoscopy under Respiratory Foundation of India. Take care, be aware. Thanks, best wishes.